Good afternoon. I'm James Mallory. I'm the chairman of the Iredell County Board of Commissioners. I'd like to give you a brief update, if I can be brief about anything, about COVID-19 and the status in Iredell County, our current situation. First off, I would recommend highly that you tune in to the video done by Jane Henson, our Director of Public Health. She can give you some very on-point discussion about COVID-19 and some of the misconceptions about the prevalence of the disease, as well as the effectiveness of ways that we can limit its spread. So please take some time to listen to what she has to share with you, because she's on the front lines and sees this every day, just as our healthcare workers and our first responders, and they know this is a very real issue. And sometimes if it doesn't affect us individually, we tend to think that it can't affect us individually, that it's just going to affect somebody else. But this disease, this virus does not discriminate against anyone. It simply acts like a virus. Today, in Iredell County, we have tested positive for a total of 1,436 cases. Of those cases, broken out in the 3 zones of the county, we have 318 in the northern sector, which is pretty close to its population per capita rate. It's about 21% of our population. It's got about 22% of our population per capita cases. That's a decline from almost 25 to 26% of our cases. So that's a good news result from north of Interstate 40. The central portion of our county, which is south of 40 and does not include the 4 southern zip codes, has about 40% of our cases with 34% of our population. So it's more prevalent in this particular area. And that has been a fairly steady number, between 39 to 40%. The southern 4 zip codes of our county, which have 549 cases as of today, constitutes about 38% of the cases and 45% of our population. Now, the reality is in the last month, that's actually gone up in terms of percentage from about 35% to 38%. The numbers that we are looking at, you see a lot of different statistics, a lot of different numbers, and you wonder, well, which ones are important? Well, the ones that are important to me mostly are the positivity rate. You know, what percentage of folks are testing positive? We know that at the beginning, first 3 months of this pandemic, the only people that could get tested realistically were people that had symptoms severe enough to warrant testing to determine whether or not they potentially needed to be hospitalized. Well, we've gone well beyond that now. Anyone who needs a test can get a test. Unfortunately, the response of the results of those tests has been delayed. It optimally should be available within a couple of days so that you can immediately come out of quarantine if you're negative, or contact tracing can be done immediately to identify people that might have been placed at risk through your close association with them. Unfortunately, when you get tests back 4 to 5 days after the fact, they're of limited utility in terms of contact tracing. So we are assured by President Trump and his team at the federal level that they are working on accelerating the responsiveness of those tests. And so we hope that our labs will be able to expand their capacity and give us that result. But the early months, you had a higher positive testing rate because people were exhibiting symptoms that got tested. In the last month and a half, we've been able to perform mass testing exercises that were done both in Statesville and Morrisville areas. And the people that were tested in those venues were primarily asymptomatic. They weren't referred there by anyone. They perhaps had a family vacation they were getting ready to go on, or they were living with a person that was vulnerable, elderly, or had some specific problems that made them more at risk than others, since they just wanted to know. When you pull that population, you're getting a pretty good random sampling of, generally speaking, what's out there in Iredell County as far as an infection rate. And we've conducted over 2,000 tests, roughly, of that type. The numbers that have come back are around 5 to 6% of a positive rate. And that is pretty close to what the state health director, Dr. Mandy Cohen, has indicated is a good place to be, 5% or less. And that really translates into roughly a transmission rate of about 2, which means that, every 60 days at a minimum, you'll double in terms of the number of people that are infected. So if we can get it down to below 5 and at or below an R of 2, that's good. There are countries in Europe that have it down well below an R of 1, or it's R.5, which means that there's only one person infected per individual instead of 2. And so we need to be pushing to get to that position. When you're able to do that, you're able to fully open up your economy. But we will have to continue to open up our economy. But the only way that we can do that is if people wear a mask and practice social distancing and appropriate hand washing. If you do just those 3 things, and the mask is probably the most critical, because this is an airborne virus, and we need to limit our ability individually to transmit it to someone else. And you do that through wearing a mask. If you wear a mask, you provide yourself some level of protection. Not complete, but between 20 and 40% or so reduction of the potential for picking up the virus, because the viral load is reduced. The concentration of the virus is, even with a cloth mask, reduced. And the more distance you have, and if you're outside, then that dispersal is such that if you're come in contact with the virus, it may be in such minute amounts that your own immune system can deal with it. So that's where we want to get to. And as Jane Henson has said, this masking process is not a political issue. I would note that President Trump this week indicated that wearing a mask is patriotic. If you've been concerned about sending a sense of, oh, well, I'm weak, or I'm another member of another party or something because I'm wearing a mask, you need to get over it. You need to wear a mask because that's how we protect others, and that's how others are protecting you. And if we all protect each other, we all have each other's back, we can put a stake in the heart of this virus. You don't need a vaccine to do that. Now, when the vaccine comes along, that'll be great. But until then, we need to wear a mask. We need to maintain social distancing, and that includes being outside. You hear of block parties out in the street. You hear of folks, just because they're outside, they're hugging, and you can't do that. If you're going to be within 6 feet of somebody, you need to be in a mask, whether it's outside or inside. If you're inside, you should be masked without exception. and I mean for any inside activity where you are less than 6 feet away from somebody. And if there's any kind of significant talking, loud talking, singing, anything like that, such as in a church or such as in a restaurant, you should be wearing a mask. Now, that's the problem with being in a restaurant. You can't eat with a mask on. So you have to be very careful when you go into a restaurant for indoor dining to make sure that they have appropriately set up their dining room tables and chairs so that you are socially distant and that their staff are wearing a mask. If they are not, then, buyer beware. You're probably going to pick up something besides your food. So be careful when you're out and about, and be cognizant of protecting others. In Iredell County, when you look at the level of activity, social activity, that has taken place between Memorial Day and July the 4th, both of those holidays kicked up our positive rate on an average for the week significantly. Prior to Memorial Day, we were running at no more than 10 cases per day on average. After Memorial Day, within a week, it was up to 15. And within 2 additional weeks, 3 weeks after Memorial Day, it was up to 20. It had doubled. And then after July the 4th, it bumped up to close to 35 a week. And it has bumped up again to up to about 42 a week. Now, I'm hoping that those numbers will start to stabilize and come down a bit. As I told you almost 3 weeks ago, in the beginning of July, we had a little less than 800 cases, and that we had essentially quadrupled the number, and our hospitalization rate had tripled from an average of 7 to 18 to 19 to 20. My concern was that we were going to experience exponential growth and that we would end up tripling or quadrupling across the board. Fortunately, I think people have, more people out there are wearing masks and being cognizant of social distancing and hand washing, because some of those numbers have started to come down a bit in terms of a trend line. If you compare our hospitalization rate, about 3 weeks ago, we were looking at having around 20 in the hospital. That rose over the next 3 weeks to 25 to 31. In the last several days, though, it has come down to 20. So that's a good news story. And we need to try to continue to push that rate down, because the majority, the vast majority of our deaths associated with COVID-19 are associated with people who have had to be hospitalized because of that. And they may have been there for 2 to 3 weeks before they passed. The number of deaths in Iredell County has doubled, essentially, in the last 3 weeks. We've gone from less than 10 to 17 at this point. So there are some glimmers of a positive trend, but that's not something that is going to continue to be unless we continue to be very cognizant about wearing our masks every day, and particularly if you have family gatherings that are beyond your nuclear family. Because you just don't know who those close family members have come in contact with. And so wear a mask in these family vacation situations or your Sunday dinners or whatever you're doing when you gather. Let me share one number that looks promising relative to Iredell County. It's a pat on the back, I suppose. And that's our per capita infection rate. Now, that depends on how many tests are given and all that, but it's a pretty good yardstick to compare us with other counties that surround us. And of the 9 counties that surround us, 6 have, I would say, significantly higher per capita infection rates. Cabarrus, Wilkes, and Catawba all right around 100, just getting ready to break 100 per 10,000 folks. Yadkin, Rowan, they're up 112 to 125, and Mecklenburg at 165. We right now are running about 78 per 10,000, and Lincoln and Davie and Alexander are between 60 and 70. So we're on the lower end of our contiguous counties, and we are the largest county that has the lowest rate. But that can change overnight. It just takes people not being intentional and slipping up. I'm going to specifically ask our pastors out there on Sundays, as you gather for worship, ensure that social distancing is maintained. If you're inside, everyone, bar none, should be wearing a mask, because you're there for an hour, sometimes more, and that's just getting circulated around. So please, for the sake of your own safety and the sake of your own flock, make sure that they are protected and protecting each other. So look forward to giving you another update in 2 to 3 weeks, and I hope that we will have positive numbers and trends to report. And I thank you for listening, and God bless and good luck. Thank you.